name is Chang Long, and I'm from Peking Union Medical College Hospital. And now I'm focused on histiocytic disorder and MPNs such as PV or ET. So it's my honor to introduce my team's work. Actually, it's just a part of the histiocytic disorder. You know that such as LCH, ECD, or RDD, they can affect theoretically each organ, such as CNS, skin, bone, lung, heart, uh, liver, GI tract. So article just focus on the kidney involvement, especially ECD and RDD. And so this study just to describe the clinical features and treatment response and outcomes of ECD and RDD with kidney involvement. Oh, yes. There's some findings which I think is very meaningful. So if we first describe the details of the kidney involvement and the treatment response in RDD and ECD, I think they are absolutely different, such as this typical renal mass in RDD with kidney involvement. But in ECD, it's just like the so-called heroin kidney. That means a perirenal soft tissue. And after the follow-up, I found that only a few patients had kidney function recovery. So we think patients with ECD and RDD may experience irreversible kidney dysfunction. So that indicates that we need for the early diagnosis and the timely treatment. We have published some articles about LCH or ECD with other organs involvement, such as lung, heart, or bone, and liver, GI tract. I think the one of the questions is that we need to a better tool to evaluate beyond PET-CT or CT. Because some lesions are not CT evaluable or PET-CT evaluable. So we need maybe some MRI or just NGS or MRD to evaluate the response. And I think different organ involvement means different risk. So in pediatric patients, liver, spleen, bone marrow are risk organ. But what are the risk organs in adult patients? We don't know. So we need further study in the future. LCH or ECD or RDD, all of them are rare disease, but in China there are a large amounts of patients. So we discovered some new treatment regimens for this kind of patient, such as low-dose cetarabine, thalidomide, lenalidomide, of course, a targeted therapy. So you know that target therapy such as BRAF inhibitors, MEK inhibitors, they are not cheap. They're very expensive for Chinese patients. So the way we maybe discovered some cheaper treatment regimens for this kind of patient. But the problem is which is better and how long we will use it. So we use for how many months, and that's a problem we need to know in the future.